Hi, my name is Blessing Sagboyeme. The title of my topic is Improving Continuity of Care by Reducing Transportation Barriers in Adult Outpatient MHMRO Settings. My project objective. The goal of this project is to understand how transportation barriers affect adults in MHMRO outpatient care and identify strategies supported by research that improve access and continuity of care, and also to identify gaps in the research literature and provide recommendations for future research. My pickup question is, in adults 18 and older receiving outpatient services at a community MHMRO clinic, does the provision of transportation support in the form of rideshare vouchers or public transit passes with staff assistance as needed compared to usual care without transportation assistance, improve appointment adherence measured as the proportion of scheduled appointments kept over 12 weeks. I chose this topic because many MHMRO patients I see struggle with transportation. They often miss appointments not because they don't want to care, but because they cannot get to the clinic due to lack of reliable transportation. This issue is important because missed appointments interrupt treatment, delay follow-up, and increase mental health symptoms. Why this topic is important? Better transportation support may improve attendance, reduce crisis, and strengthen continuity of care. Improving continuity can lead to safer, more stable patient outcomes in community mental health settings. Addressing transportation barriers supports equity for vulnerable and low-income populations. This slide, I'm going to be talking about the needs assessment. Research shows transportation problems caused missed visits, worse health, and more ER visits. Current research shows that transportation barriers remain common, but few studies focus on adults receiving mental health services in MHMRO settings. This gap is essential because MHMRO patients often rely on frequent outpatient visits. This topic matters to the students because improving transportation support may help increase appointment attendance and enhance continuity of care for this vulnerable population. On this slide, I'm going to be talking about key evidence from literatures. Jihad and others, a study conducted in 2023, showed that transportation problems increase emergency room use and even raise mortality risks. This tells us that transportation affects more than convenience, it affects patient survival. Pope and others, 2022, explained that telehealth can help reduce transportation problems, but it can't replace all in-person mental health care. A study conducted by Chapman and others in 2022 reported that low-income patients often miss appointments due to unreliable transportation. Crable and others, in research conducted in 2021, found that when clinics help patients schedule rides or coordinate transportation, appointment attendance improved. Across these studies, transportation barriers reduce access and increase missed appointment and ER use. Assistance programs help patients stay connected to care. Telehealth can help some patients, but it is not enough for everyone because some people might not have access to internet. Overall, Improving transportation support can increase attendance and improve continuity of care. This slide highlights what is missing from the research. Limited research on how transportation problems affect continuity of care and long-term appointment adherence. Little evidence on which transportation interventions such as rideshare vouchers, bus passes, staff scheduling support work best for adults with mental health needs. Limited studies include diverse, low-income or high-need mental health population who often have the greatest transportation challenges. Few studies examine how transportation barriers interact with co-occurring issues such as housing instability, limited phone access, or lack of social support. Most studies look at primary care or medical clinics. There's little research examining transportation programs over long periods. Cost information is limited. Clinics do not know how expensive or affordable transportation support programs are. We don't have enough data from the patient perspective. We need their input or what transportation support they prefer. Impact on practice. Without clear evidence, MHMRO clinic may not know which transportation solutions are most effective. Providers may miss opportunities to improve appointment adherence because transportation needs are not systematically assessed. Lack of guidance leads to inconsistent or reactive solutions instead of structured evidence-based transportation support programs. Gap limits clinicians' ability to improve continuity of care and reduce preventable ERO visits or missed appointments. On this slide, I'm going to explain the implications for research. Studies should test combined transportation strategies, for example, vouchers, telehealth, and staff scheduling support. These combined approaches work better for MHMRO patients. We also need studies that examine outcomes such as no-show rate, continuity of care, and patient satisfaction. Research should examine costs, sustainability to help clinics determine whether they can afford transportation support. Next step for practice could include testing a small transportation support program in a clinic, tracking attendance before and after, offering more telehealth visits where appropriate, and training staff to help patients schedule right. This step can help improve continuity of care. On this slide, I have the references. Thank you for listening.